So at that point, I was like more intrigued with the research path. And then at the same time, I was just going through all my clinical work. And as a psychiatrist, when you're going through residency and also going through fellowship, you have to work in the hospital and you have to do something called consultation liaison work. And what that means is that people are hospitalized for medical reasons. I mean, we worked in the psychiatric hospital too, but in this circumstance, these are like patients who are coming in for medical problems. They're in the hospital trying to treat their medical issues. And time after time after time, the psychiatrist would be called to evaluate these really complex patients that nobody really knows what's going on from a medical diagnostic standpoint. And so after they do like the multi-million-dollar workup on these patients and they don't find anything, they basically like don't know what else to do. So they call the psych team in. So this is what happens normally in the hospital. And so you can imagine what a sick patient and their family, how they feel when they have to talk to a psychiatrist when they're like, I have all these medical problems. I don't want to talk to a psychiatrist. This is not a mental problem. So they get kind of angry. So I would see all these patients because I was part of the psych team. And I always found myself like sort of being on the side of the patient and family. I would hear their story and I would not think that there's some psychodynamic or analytical problem that's causing their symptoms, even though the like attending psychiatrist would often like come up with that as a solution. I never agreed with that. And I was just like, this is ridiculous. This is obviously a medical problem that we just don't have answers to because the science is just not evolved enough or advanced enough for us to understand what's happening with them. So basically, it's a long answer to say that it was a combination of like me being intellectually interested with the whole NMDA receptor antibody encephalitis. Also, PANS PANDAS is the acronym that describes psychiatric symptoms that these kids can get after infections. So that was becoming like more on the scene. And then I had all of these like repeated episodes in the hospital. It was like different geographical regions too. So I did my residency in Boston, I did my fellowship in New York, and I encountered it like across like different cities, also with the child population and the adult population. And so it was enough to make me think, okay, I should really like be studying this more. So that's why I ended up doing the 3-year research fellowship where I was really interested in recruiting patients with psychosis. And this is because of the NMDA receptor antibody encephalitis. I recruited patients with psychosis and I was looking at a lot of immune and infectious biomarkers. And during that time, I picked a mentor, Dr. Brian Fallon, who was in the Lyme disease world at Columbia. So by virtue of him being my research mentor, I went to their lab meetings and I learned a lot about Lyme disease and how these infections can give people psychiatric symptoms. And so then when I finished my fellowship, it was just natural for me to stay on and start continuing to do work and research related to Lyme disease. So that's how I got into Lyme disease specifically.